Hey, this is Dr. Johnson coming at you again. Let's talk. Today we're going to talk about ADHD medications. What is the truth here? What is this, scary ADHD thing that I just don't want to even hear about? Here's the truth about ADHD medicines. And I really want you to get this. You might have to listen to this answer a couple times. But parents are scared about ADHD medicine. They don't even want to hear about it. In fact, some parents, if you even mention the word ADHD to them, they're not going to go to a doctor. They're not going to Google. They're not going to find out any information. Why? Because of the fear over that medication. ADHD medicine should be feared, okay? You heard me correctly. I said you should fear ADHD medicine. That doesn't mean you shouldn't use it. It means that you should be concerned about it enough to get as much information as you can before you put your child on it. Now, I am not a proponent or a pusher of ADHD medicine. I believe it should be used when it is needed. And I will also say to you that if you or your child has ADHD, there will come a time in your life when you will need ADHD medications. So let me tell you briefly about them. There are two types of ADHD medicines. You have your stimulant medications and your non-stimulant medications. Now, most people come into the doctor's office and they say, I want that non-stimulant. I want my child to have Strattera or Intuniv, or, in fact, can I just take a supplement? Give me one of those Focus Up or something like that. Okay, those don't work as well as your stimulants. They only work in people who have specific indications for them. So our first line treatment is not a non-stimulant medicine, it is a stimulant medicine. Trust me, you went to your doctor for a reason, use their expertise, and let them advise you whether your child needs a stimulant or a non-stimulant. Now, here's the deal about stimulants. They are controlled substances. What does that mean? That means that in order for a doctor to prescribe that medicine, they have to be registered with the DEA, Drug Enforcement Agency. Had to think about that, right? So the DEA controls these medicines. Now you may say, well, what's so serious about them? Why are they controlled? Well, because stimulant medicines tend to be medications or drugs of abuse. I'm going to say that again. They are drugs of abuse. What that means is that people who don't have ADHD often want to get these medicines because it will cause them to be stimulated, enhanced. It'll keep them up. The people who really abuse these medicines tend to be college students, okay? Why? Because they've got projects that they have to get done. They've got to stay up all night. They're tired. They can't focus. They can't get this stuff done. And they wander on these medicines called stimulant that all of a sudden, wait a minute, I can focus. I can pay attention. I can be productive. And so they want them, and they want them a lot. Here's the problem with a stimulant medicine, and this is why they're controlled. If you have ADHD and you take these medicines, what they do is they replace a chemical in your brain that goes to the frontal lobe that allows you to focus and pay attention. Simple, right? So when you have ADHD and you take a stimulant, we're just replacing a chemical that your body should naturally have. I don't get high. I don't get stimulated by it. My brain just allows me to focus. But if you don't have ADHD and you take a stimulant, sure, it's going to go to the frontal lobe. You're going to focus a little bit better, but it's also going to go and stimulate your entire brain. Now, wait a minute. Your brain controls things like your heart and your heartbeat and your ability to breathe. And if I overstimulate some of these parts of my brain that control other bodily functions, I can get myself in trouble. And that is correct. And that's what happens when you take a stimulant medicine and you don't have ADHD and you don't need it. You can cause the entire brain to be stimulated, and then some of your other bodily functions can get out of control. That's why they're controlled substances. We as doctors and nurse practitioners and medical providers who are registered with the DEA have to ensure that before we use these medicines, that we're giving them to a person that truly needs them and can benefit from them. Now, you shouldn't fear if you have ADHD because it won't stimulate the whole brain so long as I give it to you in the correct dose. It's just going to work on the frontal lobe, which is where your brain needs it. So this fear of addiction and being strung out and being a risk taker. That doesn't happen so much if you have ADHD and I give you this medicine. So here's the bottom line. If you or your child has ADHD, do not fear medicine. It works. It works very well. However, we have to use it in conjunction with a healthcare provider who understands you or your child and understands your need. They're going to make sure that they give you the right medicine and the right dose, and they monitor it appropriately so that you don't suffer from any side effects. Now, the last thing I want to tell you about ADHD medicine, it is not a fix. If you have ADHD, you were born with it. It's who you are. You should not be on medicine from the rest of your life to fix anything. What we use the medicine for is to give you the power to control your focus, your hyperactivity, and your impulsivity. Once I give you that control and I allow you to feel what it means to be in control over those things, then I can teach you strategies where you can still be successful without the medicine. That's how it's supposed to work. I hope to empower you over the course of these Let's Talk videos to know what questions to ask, who to ask them of, so that if you use medicine for you or your child, you're doing it smartly. If you have more questions and I didn't answer them here, don't hesitate to go to the Contact Me section of this app, pose another question, and I'll get back to you in a month. It's a pleasure talking to you. Let's talk again later.